Hi, my name is Patrick. For my senior capstone this year, I chose to do it on autoimmune diseases. My interest. I have aspirations in the medical field. When I grow up, I hope I will become a doctor, or a PA, or something that has to do with the medical field. When I was picking a topic, I had a lot of trouble deciding, but I thought maybe I'd start with my project from last year in biology, which was on BPA and the effect insulin has um, on it. And then I thought I could do it on this drug called scopolamine. But then I realized these topics didn't have enough for a whole year, and I wasn't that interested. And then my next idea was autoimmune diseases. I personally have a cousin with Muckwell syndrome, and it's an autoimmune disease that's characterized by skin rash, fever and joint pain, progressive hearing and kidney loss, damage, and this is a very rare autoimmune disease, and I want to learn more about autoimmune diseases in order to be more knowledgeable and be able to comfort my cousin who's just going through a lot of pain, and she doesn't need to, and she's a very young girl who just suffering from this autoimmune disease. My mom tells me how sometimes she can't fall asleep because the ear pressure is so high, and all her joints ache, and it's just very, very sad. Um, in addition, I have my own personal experiences with autoimmune diseases. When I was a couple years ago, I had my hands turned actually blue, and my parents thought it was Raynaud's phenomenon, which is when your vessels vasoconstrict, making your hands and your other extremities, like your feet, to turn a blue or white color. Luckily, my test turned out negative, and it's just kind of a weird thing that happened to me. So, a little background on autoimmune diseases. There's a clear distinction between the innate and adaptive immunity. Autoimmune diseases have to do with adaptive immunity, and there's also some other thing called autoinflammatory diseases, which have to do with the innate immune response, which is kind of your non-specific, your first line of defense, your inflammatory response, complementary response. Um, and autoimmune diseases is your body's immune response against substances, organs, and tissues of yourself. And this is why it's so interesting, because I've always wondered, why does the body attack itself? Um, there are more than 80 types of autoimmune diseases, and it is very difficult to treat and diagnose just because the symptoms are so complex. We don't know a whole lot about them as we know to other more common diseases like the cold or the flu. And it's very hard to diagnose because there's not like one specific way. There's not one symptom that says it's this autoimmune disease or not. And part of this project was spending a lot of time reviewing biology, basic biology, vocab words to help me understand these complex review articles. Notable papers. One of the first papers that I read, the first topics I researched was polyautoimmunity. This is the idea where if you have one autoimmune disease, there's a higher chance of you having other autoimmune diseases. Two papers I looked at were Introducing Polyautoimmunity, Secondary Diseases No Longer Exist, and Polyautoimmunity and Familial Autoimmunity and Systematic Sclerosis. After reading these papers, the conclusion was there's a higher risk based off genetic factors. In addition, females have a higher chance. It can be triggered by the environment. There are different rates of polyautoimmunity in different countries, which I'll explain in a few minutes. And there's an idea of epistasis and pleiotropy, which is the idea that one gene affects many different phenotypes, and in this case, those phenotypes are those symptoms, and therefore the other types of autoimmune diseases accompanied by having, let's say, one autoimmune disease. The idea that you have more than one autoimmune disease. This is a table from my second paper, Polyautoimmunity and Systematic Sclerosis. It helps to look at one side first. Basically, there's two big categories: the Canadian cohort and Colombian group. And what this table showed was that people who had systematic sclerosis, which is a pretty common autoimmune disease, a good amount of them had other autoimmune diseases. In addition, there's a high percentage of women in either who have other autoimmune diseases or don't, who have systematic sclerosis, 88% and 85%, Colombian cohort 96 and 86%. And then in addition, the number with first degree relative with autoimmune diseases, what this means is any close family members like brothers, sisters, dads, uncles, aunts, any of your close family members, if they have autoimmune diseases or not. And as you can see, the people that had autoimmune systematic sclerosis, there was a good amount of relatives who also had an autoimmune disease. As I said earlier, there's differences in countries with polyautoimmunity rates. In the Canadian cohort, compared to the Colombian cohort, it seems like the Colombian cohort has more people who have the idea of polyautoimmunity. And this is because that there's differences in the environment. The environment can trigger autoimmune diseases, anything from epoxy resins to sunlight. In addition, there's different genetic variations within these two countries that are so far away from each other. The next paper I read was a comprehensive analysis of shared loci between systematic lupus and 16 autoimmune diseases reveal limited genetic overlap. This paper looked specifically at systematic lupus, SLE. Systematic lupus is the most common type of lupus. There's other types of lupus like neonatal lupus and some other ones, but the most common one is systematic lupus erythematosus, which is SLE for short. And they describe the link between lupus and having other autoimmune diseases as modest, which you may think would contradict with the other paper, but the other paper was just saying in general there was this idea of polyautoimmunity. So specifically for SLE, there was the link was modest between having shared loci. And this was kind of my link to the next chapter, which was on systematic lupus erythematosus. My plan. Halfway through the beginning of the first semester, I was kind of lost. I didn't really know where I wanted to go with my project. So I had a meeting with Mr. N, and here we discussed what I would do next. So my plan eventually will have my capstone project will have 3 chapters. One on genetics, one on lupus, and one on rheumatoid arthritis. And the first chapter on genetics will include polyautoimmunity and other genetic information regarding autoimmune diseases. And then my next 2 chapters will be specifically on 2 very common, well-known autoimmune diseases in lupus and rheumatoid arthritis. Within those chapters, I'll look at the diagnosis, treatment, and new understandings and new advances in understanding of these 2 autoimmune diseases. We also talked about how I would look at papers written by doctors versus papers written by molecular biologists. And the reason for this is because I wanted to go in the medical field, and because I'm more focused on the doctor point of view of autoimmune diseases. It would make sense to read papers written by doctors to provide more of a different perspective on these diseases. Another notable paper I looked at was B-cell targeted therapy in systematic lupus, potential of rituximab, which is a type of drug used to treat lupus. It's directed against the CD20. It's a marker for the B cells, and this prevents abnormal B cell proliferation. And what B cells are, they involve in the presentation of self-antigens, T cell activation, and productions of autoantibodies and cytokines. The drugs like rituximab are immunosuppressants, which mean they are drugs which are used because the immune system is hyperactive. They kind of calm the immune system down, which help with the symptoms of autoimmune diseases. Within this paper, I found new keywords like Selena Slade and belimumab. Selena Slade is a type of diagnosis scale, which you have to have, I think, 4 out of the 7 symptoms in order to say that you have lupus. And this other keyword, belimumab, is another type of drug which is used to treat lupus, which I think I want to look more into. And part of this project is finding new keywords and then finding new papers using those keywords. My current research and goals. I'm looking at the new treatment which I just discussed, and my goal is to contact Dr. Zimel at the Connecticut Children's Medical Center, who is actually the doctor who looked at my hands when my parents died of Raynaud's phenomenon. I'll also continue my chapter on lupus, and also the different ways lupus is diagnosed. Then I'll move on to my rheumatoid arthritis chapter, and then I'll begin this process of writing and revising and making the PowerPoint and finishing my senior capstone. Thank you. Thank you.